Good morning, everyone. I am Dr. Vijeta, and today we are going to discuss evaluation of primary and secondary amenorrhea. The reference for this PPT is the current evaluation of amenorrhea, a committee opinion ASRM 2024. In this video, we will be covering the definition, the causes of the amenorrhea, evaluation of amenorrhea, investigation which all will be needed, and the approach. Coming to the definition of amenorrhea, it is the absence or cessation of menses. Absence is that is primary amenorrhea, or abnormal cessation that is secondary amenorrhea. Let's discuss when to evaluate. What is the age at which we'll start the evaluation of. So let's discuss the standard deviation curve first. So this is the standard deviation curve, that is bell-shaped curve, and this is the mean age of getting the menses, that is 13 year of age, and plus 2 standard deviation, that is 15 year of age. So we have to evaluate by the age of plus 2 standard deviation above the mean, that is 15 years in presence of secondary sexual character. And the additional point which is given in 2024 ASRM guideline, that is, if the breast development occur before the age of 10 years, then 5 years later to the breast development will start evaluation. For example, if the breast development occur at the age of 9 years, then we have to add 5 years, that is, it will make 14 years, and will start evaluation by 14 year of age. So coming to the conclusion, primary amenorrhea is defined by 13 years if there is no visible secondary sexual characteristics, and 15th year will start evaluation if there is presence of secondary sexual character. And one more points we have read, that within 5 years of breast development, if the breast development occur with less than 10 years of age. This is just a recall of delayed puberty. Delayed puberty in girls when they do not develop breast by the age of 13 years, and when there is no onset of menses by the age of 15 years. Coming to the definition of secondary amenorrhea, it is the absence of menses for more than 3 months in normal regular menstrual cycle females, or 6 months if the patients or girls who had irregular cycle, and then will need investigation. Coming to little bit about the physiology of menstrual cycle. So this is the HPO axis which we are familiar. Hypothalamus will produce gonadotropin. Then gonadotropin releasing hormone will act on the anterior pituitary, and the anterior pituitary will release LH and FSH hormone, which will act on the ovary. In turn, ovary will release estrogen and progesterone, and these estrogen and progesterone act on uterus, and if the fertilization will not happen, then menses will occur. So for a normal menses cycle, these all things, first the higher mental function, central nervous system, then hypothalamus, then anterior pituitary, ovary and uterus, all should be functional so that the menses can occur. Coming to the requirement, that is the functional component and the structural component of for having a normal menses. So as we have discussed in the previous slide, this is hypothalamus, anterior pituitary, ovaries and genital outflow tract, that is uterus and cervix and vagina. So for evaluation of the patient with amenorrhea, will go in the order in reverse direction. That is, if the patient came with primary amenorrhea, first we will ask if there is any pain during menses, pain during every month she is feeling any pain, so that will rule out any imperforate hymen or transverse vaginal septum. Then if it is not there, then we'll go to the Ovaries. Ovaries may the cause of primary amenorrhea like Turner syndrome will ask the patient about the secondary sexual character development or not. Then we'll come to the pituitary. Then we'll come to the hypothalamus. This is the basic of evaluation that will start in the reverse direction so that we will easily evaluate the patient and got a diagnosis. We will discuss the causes of primary and secondary amenorrhea in the subsequent class and then how to evaluate these patients. I hope you enjoyed this. Thank you.